Hi, this is Dr. Dembski again. Today we're going to talk about a condition called tennis elbow, also known as lateral epicondylitis, which is right here. The lateral epicondyle is just a part of your humerus bone, and when it gets inflamed, the condition is called tennis elbow. Now the muscles that get involved are the common extensor tendons, which extend the wrist and extend the fingers. Now, most people that get this condition do not play tennis, so you don't have to play tennis to get this condition. It can be caused by anything from overuse to desk work to working a jackhammer. There's many reasons why people will present with this condition. Before we get into how we're going to treat it, I want to make a differentiation between acute tendonitis and chronic tendinosis. Most people, young people under say 30 years old, 35 years old, it's an acute tendonitis, and that should be treated with ice and rest and stretching, and in severe cases a cortisone injection. Most people over 35 years old are suffering from a condition called tendinosis. Now tendinosis is totally different. Tendinosis is a chronic condition. It's a chronic degenerative condition of the tendon, which involves infiltration of scar tissue, weakness, and tightness. And because a tendinosis is different from an acute tendonitis, it should be treated differently. Now, the majority of the medical community still treats all tennis elbow conditions, including the tendinopathies or the tendinosis conditions, as if it was an acute tendonitis. And they treat it with anti-inflammatory medications, rest, and cortisone injections, and physical therapy. Many of these conditions do not get better because the actual problem is a chronic tendinosis. And in a situation with a chronic tendinosis, we need to kind of disregard the inflammation, the inflamed tendon, and treat the cause, which is scar tissue infiltration, weakness, and tightness. And to do this, it's not very difficult at all. I'm going to go ahead and show you, actually. It's just easier to show you than do it. First thing we do is treat you with the laser. And we would apply the laser right to the lateral epicondyle. Let me just kind of lift it up. And this is going to stimulate tissue healing at a cellular level. We're going to follow that up with the instrument-assisted soft tissue manipulation. We're going to do cross-friction type massage, which is focused on breaking up scar tissue and increasing circulation. And then we're going to follow up with some form of manual muscle therapy, such as active release. And we're going to give the patient stretching exercises and strength training exercises. To stretch it, it's very simple. We're going to do this type of exercise here, but we're also going to stretch the flexors, because there is a relation between tight flexors and lateral epicondylitis. So we're going to stretch your extensors, which are the muscles involved, but then we're also going to stretch the antagonistic muscles, the flexor group, by stretching this way. And the person should do this 10, 15 times a day. We're also going to have an exercise. There's many different ways you can exercise the tennis elbow. The one that I like the best is with this tool, which is called the Dynaflex. Dynaflex is a gyro. You basically, get this thing going, and it will exercise all the muscles of the forearm. It actually becomes quite difficult to hold on, so these muscles are working very hard, and it does an excellent job of rehabbing a tennis elbow, as well as improving throwing and golf and tennis. Another way to work the lateral epicondyle, common extensor tendons, is with a weight by doing wrist extensions. So, in summary, we're going to treat the chronic degenerative tendon, which consists of scar tissue infiltration, poor circulation, weakness, and tightness, with cold laser, Graston technique, active release technique, stretching, and exercise. Majority of conditions will resolve within 4 to 6 weeks and take approximately 8 to 12 visits. Thank you.